Hello, everyone. I'm Carmen Berry with Partnership from A Healthier America. As PHA's registered dietitian, I work across programs to ensure best practices in nutrition are met, including my work with Veggies Early and Often as one of the authors of the resources you'll be receiving after this call. I'm also a mom to a 3-year-old, so I know firsthand how challenging but rewarding it can be to embark on a feeding journey to raise an adventurous, veggie-loving eater. I welcome you to today's conversation with clinicians who are making it their mission to help families build a lifelong foundation for healthy eating. Feeding a baby during the first 1,000 days of life can be an exciting adventure for parents, caregivers, and babies alike. Clinicians can play an important role in providing families with timely, credible information at key stages during a child's feeding journey because of the continued care they provide early in life. That's why PHA, in collaboration with the Dr. Yum Project and a multidisciplinary team of child experts, created new anticipatory guidance for clinicians and champions of first foods titled Raising Adventurous Eaters with the First Foods. Raising Adventurous Eaters with First Foods is an initiative of PHA's Veggies Early and Often campaign, which aims to raise a generation of adventurous eaters in partnerships with health professionals, food manufacturers, and early childhood educators. We're lucky to be joined today by two of the authors of this new patient education resources. I'll introduce you to these two PHA partners in just a moment. But first, I want to give you a quick overview of what you can expect from today's call. The authors will walk us through a new resource. We'll walk us through all of the new resources at a high level, and I'll also moderate a discussion with them about what is important to understand about these resources and how clinicians and champions of first foods might begin to use them by helping families identify proactive and practical activities to support feeding development and build healthy habits at key stages of a child's feeding journey. By the way, you're the first audience to see and receive these new resources. Directly following this call, you'll receive an email from PHA with a link to download the full series in both English and Spanish for free. So let's get right to it. I want to welcome today's speakers, Dr. Namali Fernando and Dr. Kofi Essel. Dr. Namali Fernando is a board-certified pediatrician, founder of the nonprofit, the Dr. Yum Project, and the owner of Yum Pediatrics, a nutrition-focused practice with a teaching kitchen and a garden. She's also the co-author of the parenting book, Raising a Healthy Happy Eater, and Dr. Yum's Preschool Food Adventure, a research-backed cooking and nutrition curriculum. Welcome, Dr. Fernando. Dr. Kofi Essel is a board-certified community pediatrician at Children's National Hospital in Washington, D.C. He serves as an assistant professor of pediatrics at the George Washington University School of Medicine, where he's also director of the culinary medicine program, the Community Urban Health Scholarly Concentration, and the Clinical Public Health Summit on Obesity. Good afternoon, doctors. So I'm going to pass it over to both of you to walk us through the high-level overview of our new patient education series, Raising Adventurous Eaters with First Foods. Kofi, over to you first.
Excellent. Thumbs up, you can hear me okay? Yeah? Excellent. Okay, so really excited today to get into this discussion, to dive into these new tools that we've been working on for a while. They are very, very much a breath of fresh air into your clinical practice settings. I want to start with just a quick introduction and sharing a little bit about how I got into this work. I remember a few years ago, actually in my residency, when I was training, I was working with my patients, I was doing my primary care time each week. And I remember sitting in front of a family, and the family was around a 4 or 5 month old, and they were asking me, hey, my child is wanting to start solid food soon, and I know this is an important thing, but what do I do? How do I get started on that process? And I remember them looking at me, and I looked around the room, and I realized I was the only one there, and I had to answer these questions. I realized I knew nothing about this topic. So of course, let me go grab my attending and bring them in, and then we'll do this together. I remember going to grab the attending, and them feeling uncomfortable in discussing this topic as well. And I realized at that moment, we had let our patient down. And I realized at that moment when I talked to my colleagues around the country that there was a lack of understanding in this topic in general. Addressing this concept of the first 1,000 days, incorporating these great foods early on, recognizing the role we can play in the life of that child and that family, there was a gap there. And our system had let down our family. And I knew from then on, we had to figure out how to do this in a more effective way. So I've been really invested in this work since that time. And it's just been a great opportunity to work on this. Look out, get ready for these great tools coming your way. Namali.
Hi there. I'm so happy to be with you today. My name is Namali Fernando, and I am a pediatrician and founder of the nonprofit, the Dr. Yum Project. I too have been interested in obesity management and prevention of obesity, and really, like Kofi, felt vastly underprepared to talk about nutrition topics with my patients. So about 10 years ago, I started doing the only thing I knew how to do, which was to share recipes. And that really resonated with my patients. And it set me on this journey to find practical ways to share nutrition information with my families. And in that journey, I met my good friend, Melanie Potok, who's a speech language pathologist who specializes in pediatric feeding. And we set out to create a cooking curriculum and had a lot of discussions about raising great eaters through a lens of development and parenting. So we set out to write a book called Raising a Healthy, Happy Eater that really looked at raising great eaters through those two lenses. And after that process was over, I decided that I would create some handouts. Not every parent is able to sit down and read a whole book. So we took that information from the book and distilled it down into a series of handouts, which for years I was giving patients during their well visits. And I found that to be very helpful. Parents could take them, share them with families. I also created this little cooking class in my teaching kitchen, which invited families to come in and try recipes with their babies and learn about feeding, and really started to hone in on this idea of a family approach to feeding babies, sharing recipes with your baby that are the same recipes that the family is eating. And it really resonated with parents. So fast forward, PHA invited us about 2 years ago to be a partner in their Veggies Early and Often campaign. And we were so delighted and honored. We were really in awe of this very evidence-based approach to changing the landscape of early feeding in this country. And so we signed on. And about, I guess, 6 months ago, we decided to ask them if they would really spearhead the reimagination of those same handouts. How can we bring a multidisciplinary team together and bring their nuance and experience into a really comprehensive set of handouts? And how can we disseminate those to families across the country through providers like you and agencies like yours that may serve children? So we're delighted that this has finally come to fruition, and we wanted to unveil the handouts. And this is the complete set. We can't believe this day has come where we get to show them to the world. As you can see, they are very bright. We've tried to make them inviting and conversational in their tone. We wanted to make sure that they could be easily distributed. And so what Kofi and I are going to do now is actually walk through each of these handouts so that you can see sort of the highlights of each of them. So there are actually 7 handouts that can be passed around, and there's an overview guide as well. Now, the overview guide is really meant for you, just to learn about the overall scope of the project, who is involved with the project. So we have a multidisciplinary team, as I mentioned, which is comprised of pediatricians, dietitians, and a speech language pathologist. We worked very hard bringing our individual experience and evidence to this set of handouts. And we're a diverse team. I'm really proud of that as well. We have a diverse patient population as well, and we wanted that diversity to be reflected in the handouts as well. And so PHA invited a firm called Lexington Writing Group, and they actually did a sensitivity review so that we could make sure that the handouts actually reflected the diversity of our team and our patients and were as inclusive in its language and presentation as possible. We also invited parent focus groups, a diverse group of our own patients, to preview these handouts and give us feedback. And we were actually very delighted to see that a lot of the feedback was very positive, very warm, and the parents really enjoyed the family-centered approach that we took with the handouts. And then lastly, the overview does introduce the two collaborating organizations, PHA and the Dr. Yum Project. And you'll see throughout the series, there are QR codes that lead parents back to those two organizations. And that's really intentional because we want parents to be able to explore the work of Partnership for a Healthier America and all the incredible initiatives that they have, and also to explore the Dr. Yum Project's resource, which has a lot of tools and recipes, videos, blog posts, lots of exciting information for them to continue to learn.
Excellent. Let's get started. So this overview right here, one of the first things we started was with this concept of recognizing the role of the first 1,000 days, right? So with the first 1,000 days, we think about conception to the age of 2. With the idea of conception, right, that prenatal period, how do we take advantage of this time and really promote high quality nutrition that really supports the child and the family? So with this guide, this handout early on, you can see a few things on this guide that you'll be able to use and provide to some of your patients. We know a lot of you all will see or do prenatal visits, and as well after that period of time, in that sort of postnatal period, you can also provide these tools as well to parents as well. On the bottom left of the guide, you can see there's a space there that you can sort of tailor this guide or all of these guides to your practice in particular. Feel free to put your logo, feel free to put any sort of writing or a description of your practice in particular. Again, the idea of tailoring it for your site. We wanted to make sure that happens as well. With this resource on the prenatal, postnatal period, we really highlight some key important nutrients that can really empower and help the parent and also the child. We talk about the importance of hydration and of course, short and long-term impacts of nutrition, how short-term changes, things that the parent is doing while the child is in the womb can make big changes later on, influencing the palate, development of the brain, all kinds of things later on as well. So these are some really important high point topics focused on in this handout.
Sorry, I'm having a little trouble advancing. There we go. So the 4 to 6 month guide is, sorry, I'm a 1 to 4 month guide, getting ahead of myself here. This is really a place to get started thinking about future feeding, but also to talk about the overall concept of responsive feeding. So of course, many of us are breastfeeding advocates, but we are sensitive to the fact that there are a lot of complex situations and decisions made around whether a family will breastfeed or bottle feed. And so we wanted to be sensitive to that and overall introduce this concept of responsive feeding, which is really taking the baby's lead and following their own hunger and fullness cues to decide when a baby should be feeding. And this is a concept that is echoed throughout the series, especially as we start solids. We wanted this to be a tone setting handout. So we answered a lot of frequently asked questions about starting solids, when to start, so that families would sort of have a timeline in place before maybe they started too soon. And I think it's important to acknowledge that the current feeding practices may look very different from a generation or two ago. And so this is something that families can share with their own family members or caregivers, nannies, to show what the current feeding practices are. So we do answer questions like, is it okay for babies to start water at this age? Do you need to put cereal or other foods in the bottle? We wanted to just set the stage with what the current evidence is. We also have this awesome section called Boosting Feeding Development. Feeding is a developmental process. It's a complex coming together, actually, of many developmental processes. So starting with this handout, you'll see this Boosting Feeding Development section, which goes through activities in the areas of gross motor skills, fine motor skills, communication or cognitive skills, and training, taste training. And these are activities that parents can do to really boost their child's feeding development.
Excellent. The 4 to 6 month guides are really great guides as well. We are very familiar with all of the sort of the debate around should you be starting solids at 4 to 6 months or after 6 months. There's all of that is out there, and we've made a stance, really reviewing the evidence, and came to the conclusion of focusing on around 6 months as the goal. That's really what we're focusing on. We're looking for signs of readiness, making sure that child is ready. We know when you look across the board, about 30% of families will choose to start solid foods less than 4 months, about 50% between 4 to 6 months, and about 20% after that period of time. And we know that's concerning. So we wanted to make sure that families are getting the foods at the right time and getting to take advantage of that taste window. We also know between that 4 to 7 month window of time that kids or babies are oftentimes very open to a variety of different flavors. So we wanted to take advantage of that open window as much as we could. So we're focusing on the idea of recognizing that the child is ready, and when they are ready, making sure that we're getting them ready by introducing them a variety of different flavors. The idea of repetition is incredibly important. We talk about the studies that focus on 8 to 15 times of trying a different flavor on multiple days before that child may actually get used to that. We really recognize that. There's also some really great evidence looking at a number of different products in many different stores around the country. And when they look at over 500 different products that are focused on infants and toddlers, we're only seeing about 10%, less than 10% actually, that are single vegetable ingredient items. So the most of these foods are covered by fruit or sweeter flavors. And as a result, it just sort of leads into that natural predilection for kids towards those sweeter foods. So all we're doing is really re-enhancing that. So the idea of expanding that palate, creating a more adventurous palate, starts early on. We give you strategies on how you can do that with this early guide. I want to also highlight this icon at the bottom. So PHA has done a great job with introducing this icon that's starting to be used in early child care centers, and also with a lot of food manufacturers as well, when foods are really meeting certain milestones, such as having more than 50% of that item being vegetable centered. So wanted to highlight that, but next slide.
So at 6 to 9 months, this is really when families start to get really energized and start introducing lots of foods. And so we wanted to really highlight how to do that safely, how to introduce a lot of different flavors and textures. This is a wide open window where babies are eager to try lots of foods. And so we wanted to show families how to do that safely. And we wanted to make sure that we're doing a lot of variety, but not necessarily a lot of volume. So we highlight the importance of continuing to offer the important nutrients in breast milk and iron-rich formula, which is where the vast majority of calories and nutrition should still be coming from at this young age. We also wanted to make sure that families understood that most of the foods that they're offering fall into that low allergen group, and that there doesn't necessarily have to be a waiting period between most fruits and vegetables, particularly, and that they can go at a pretty rapid pace and take advantage of that flavor window. We also wanted to share the evidence that high allergen food introduction at an early age, ideally before the age of 12 months, and frequent reintroduction can reduce the risk of food allergies. And then, of course, there's our boosting feeding development, really taking notes from our SLP colleagues and their experience with the importance of positioning babies. We highlight that in particular. A lot of parents ask about a feeding chair. So we want to make sure that whatever feeding chair they choose, that they are properly supporting the back and the feet to make them comfortable for optimal feeding.
Excellent. So we also have a guide on safe eating tips. So we wanted to make these super easy to use, not too many pages. So we offered this as a separate guide for our families as well. In this guide, we focus on a variety of things. You can see in the top right on the right image, you can see those top 9 food allergens, right? That sort of cause more than 90% of the allergies in children, right? We offer those early on and talk about the importance of giving those foods frequently, often before the age of 1, recognizing that that's a huge goal that we're trying to do and not waiting, as we've talked about in years past. We talk about strategies on serving different foods. You can see here different strategies on terms of how foods are cut, how soft they are, a variety of different techniques we talk about here, such as matchsticks versus handheld versus shredded, We don't dive as much into infant-led weaning strategies, but we know a lot of our families will use those strategies. So as a result, in addition to that, as well as rapidly expanding or creating an increased texture in the foods, all of these options, we know that families sometimes may experience the experience of gagging in their child or versus choking. And we wanted to make sure that we demystify what gagging is versus choking, recognizing that gagging is part of the developmental process. It's kind of like training wheels to some degree. We want them to be aware of that, what they're looking for, and then what do you do to respond? And what does choking look like, and how is that different as well? So we talk about those things throughout this handout and a few other concepts as well, but I'll pause there. Next slide.
The 9 to 12 month guide really highlights the diversity of food that should be offered at this age, and really focuses on making sure that babies are working on their fine motor skills, feeding themselves. And we offer a lot of sort of ideas about what kinds of finger foods babies should be eating, with a QR code back to the Dr. Yum project, where we have a post on 10 ideas for finger foods. It is important, I think, too, for parents to recognize that there are a lot of toddler snacks that are available, and to make sure they're reading the labels, because many of those may have too much salt and sugar for that particular age group. And then again, using notes from our feeding specialist colleagues, we wanted to make sure that families are starting to introduce the concept of cup drinking, whether that be an open cup or a straw cup, which is the preference of a lot of SLPs, just for the fact of the strengthening of important muscles that are used for eating and for speech.
Excellent. And this is our last guide. This is our toddler guide. You can actually use this throughout that toddler period, especially from 12 months to 24 months. And we kind of think about that as our toddler guide. This is the biggest guide because we were covering such a wide breadth of topics as well. This is important to understand. In general, we see a lot of great studies talking about how most parents may introduce a food once or twice before they determine if the child may like it. And we've talked about the importance of that replication, that repetition rather. It's incredibly important for these children. We also recognize that a lot of children, they may start to not want to eat as much. That adventurous eater that we're developing may seem like, hey, I'm not as hungry anymore for those foods that you were giving me. And that's okay. Not blaming the child, not blaming the parent, and recognizing their growth is starting to slow down. And it's okay if they start to be a little bit more choosy with some of the foods that they're doing, and recognize this is not going to last forever. But keep doing what you're doing, not pressuring them, offering them the right types of food, and recognizing they don't need that much food to be able to maintain and grow the way they need to be growing. So we highlight that as well. We talk about the importance of balanced meals with a variety of different kinds of foods as well. Again, not creating those food jags where kids are eating the same thing over and over again, trying to create ways in which you can expand that out. We also talk about the importance of discontinuing those bottles and those pacifiers, when to do it, how it will not malform teeth if you're doing it at the right time. And lastly, how do you create a positive feeding environment? How do you create an environment where you're allowing kids to actually see some of those vegetables and other foods in the food that they're eating, and not always hiding them? But at times when you need to hide them, sometimes you just need to hide them, and that's okay as well. How do you create an environment in which you say the right things to the child and not create this very negative association and relationship with food? That starts early on, that starts here. We give some great strategies there. I'll pause there and pass it back to our team member.
Amazing. Thank you so much for that overview of our new patient education series, Raising Adventurous Eaters with First Foods. It was incredible to work with both of you and the rest of the authors on developing these handouts together. I'm really proud of our work, and what's most exciting to me is that we get to share these resources with all of you on the call, and with so many families looking for that credible information on how to boost feeding development and build those healthy eating habits at every stage of a child's feeding journey. So that's what inspires me about it all. So now I'm going to kind of turn it over to a conversation with both of you about these new resources and ask you guys some questions. And then we'll open it up to the end for a Q&A for anyone that's watching. If you have any questions, feel free to type them in the chat as you think of them. So I'm actually going to start with you, Namali. Why is there a need for these resources?
Well, let me start by saying thank you, Carmen, and the rest of the PHA team. There was so much behind the scenes work that you all did to make sure that the guides were very concise and very clear for parents. And it was a ton of work, and it was a pleasure working with your team as well. So I think the reason the guides are so important, I guess there are two reasons. One is, I think most of us who work in pediatrics are acutely aware of time and how many topics that we have to cover in such a short amount of time. There's, discussions about development, safety, making sure that we're getting a good physical exam. At this age, sometimes that's very challenging. There's the parents' own concerns. Maybe there's a sick complaint as well. So the time that we have, 15, 20 minutes, really just goes too fast. And sometimes the conversations about nutrition really get crowded out by a lot of these other topics. But this is a really important topic. It's one of the most important conversations that we can have. And so it is nice to have that kind of comprehensive resource that parents can walk away with. And if they didn't get to ask their feeding questions, or you didn't get to cover feeding in the way that you had hoped, at least they're going home with good information. The other thing that I have noticed is there's so much information about feeding that parents can get from so many different sources. There are books, there's the opinion of family members, there are blogs, there's social media. Everybody seems to have an opinion about feeding, and it's hard to know how to filter through all of that and to get one expert guide that sort of covers all of that. And also can be shared with family members to bridge the gap between their understanding of feeding and what's current, I think is wonderful. And it's what I've seen in my own practice. I think families sometimes, even if you have the time to spend with them, they may not necessarily be focused, or they may forget some of those topics, and they can at least go back and review them later.
Yeah, I remember when I was a new mom, I was that person that would have I would text myself a bunch of questions because I'd forget them as soon as I got in there. But I completely agree with what you said, that the internet is just full of information, and like talking with your family can be really overwhelming for new parents. And many people don't know where to find that information that's not only credible, but also easy to understand and use, which is what we hope for these guides. So Kofi, I want to bring you in on this next question. Since many new parents are relying on their pediatrician to answer or address a wide variety of questions and feeding concerns, what are some of clinicians' biggest pain points when it comes to playing a role in infant feeding or the introduction of solid foods?
Let me reiterate what Namali mentioned: time, and time. And I was thinking back to yesterday. I actually was seeing a patient, and the child was 6 months, and the parents were, it's the first time I was seeing them, and they wanted to talk about solid food introduction. And we were talking about some of the big 9 allergenic foods, and they were like, I was talking about them, they were writing them down, and I'm like, you shouldn't have to write all these 9 foods down. There should be a way in which I can sort of engage with you quickly, circle some things, and get you through some high level points and get you on your way going. And that's what these tools really provide. That's a big pain point that I find in our practice that my colleagues share all the time. In addition, sort of keeping up with what's out there, right? There's so much dialogue about this. How do we keep up with all of this? This is putting it all in one place, which has been really valuable. Let's not also forget to mention about our training in nutrition. We don't get a ton of training in nutrition. We know it across the board, and I can talk about some of the studies where, in general, the recommended average hours of training we are supposed to be getting is at least 25, as recommended by the national academies, in the 80s. But the majority of schools don't even meet that minimum number. 71% of schools don't meet that minimum number of hours. A third of those schools don't meet half of those number of hours. When you look at residencies and fellowships, we're all saying the same thing. We don't feel equipped to talk about these topics. Not trying to be dietitians, right? We're not, Carmen, we're not you. We can't be you, and we shouldn't be trying to be you. But what one of my colleagues says in Texas, he says, the goal is to do no harm. How do we do this in a way that we're not actually creating more harm to our families, but actually benefiting our families? This is a huge pain point, our discomfort with this topic. Yes, and sometimes we become parents or aunts or uncles, and we all feel like we're experts now, right? But at the end of the day, some of the techniques we may use may not translate necessarily to all of our patients. So figuring out strategies that are universal, that families can all benefit from, that really allow for an expansion of the palate, for prevention of allergies, for an improvement of the environment to improve brain development. These kind of things are critically important, and this is where some of the pain points are.
Yeah, you're right. It's really hard, and I almost want to say maybe impossible to be this one-stop shop for everything when it comes to children and infants. It's key that we rely on other professionals and these credible tools that are available to assist, like our new patient education series. So this next question is actually for both of you. So in your view, what's one thing that needs to change so clinicians can help families raise adventurous eaters? So Namali, I'll pass it to you first.
Yeah, I think number one is just making sure that we're not just thinking of the child as the problem and the solution. We really should be thinking of the child as part of a family, and even take that further. The child is part of the family who's part of a community, right? So the solutions to improving a child's nutrition are really far reaching. We have to be thinking beyond just the first foods that we give these kids. It's a statistic we hear all the time. 10% of children get the recommended servings of vegetables per day, but only 9.7% of adults get the recommended servings of vegetables per day. So as hard as we work to feed these babies the right foods, we want to make sure that these babies land in families that are eating the right foods, right? So this is why I think that family-centered approach was important for us to bring into this series, and recognizing that families can share meals with their babies. And this is something that I've seen time and time again through my classes, is I would show a family that their 6 or 7 month old baby can eat a recipe from the Dr. Yum Project, like curried lentils with spinach and brown rice. I mean, families were so excited to see how interested their babies were in foods like that seemed like grown-up foods. But these are really family foods. And what I've seen over the years is that the families, many of whom were my patients, would come back and say, wow, we're eating that recipe for, Sunday dinner every Sunday now. It's become a favorite recipe. And so if we can move the needle on how the family eats, then we're taking this work beyond the toddler years. And that's, I think, one of the most exciting ways that we're starting to think about feeding babies.
That's great. Kofi, what are your thoughts on the question?
So let's start with those curried lentils. The idea of being able to enjoy flavorful, diverse foods from all over the world or your particular culture is so important. You mean that my child doesn't just have to eat these, dried carrots all the time? Like, there's flavor here. There's adding seasoning, there's spices. There's all kinds of ways we can do this and create a very, very varied, adventurous palate. And these are the strategies that really can help set our children in the right direction. I think about some of the work that's being done around the country, the 1000days.org. They're doing some phenomenal work. This work is being done around the world even. We're missing out on some of these things because why? We sometimes think about these first 1000 days as forgotten years. We're not focusing on them much. We're focusing on what happens afterwards. And unfortunately, our sort of Western medical education oftentimes focuses on that reactionary medicine. But what about prevention? What about thinking about these strategies that creates that healthy palate? These are things that we can do early on. 80% of the brain is developed by the age of around 3, about 90% by the age of 5. These kind of strategies can transform the development of that child and that family. Now, I love what you said about thinking about this as through a family-centered lens. The other thing I think is just that recognition of a mindset shift for us. Again, the idea of looking at these years as valuable years, looking at these years as places or touch points in which we can make a huge, huge change in, again, prevention of allergies. And again, expanding the palate, and again, allowing for a prevention of disease later on by creating that palate early on. And I think these are some important things that we think about.
That's great. I always think food really brings people together, and mealtime is such an important family bonding opportunity as well. So I always want to try to put the joy back into family meals and kind of release that stress and anxiety that I have as a mom too when it comes to feeding a young eater, kind of shifting that mindset. I love that. So the next question here is for you, Namali. As a pediatrician with your nutrition focused practice, what strengths have you used to disseminate handouts on feeding so that your parents or families can learn and take a proactive approach?
Yeah, so all of these years where I've used feeding handouts, the strategy that has worked best is really allowing our staff, our receptionists and nurses to make sure that for the next day's work, we have those things ready. So our staff is pretty organized. They identify who's coming in the next day, and they get those handouts ready so that when they check in, the receptionist hands them everything they need, their check-in paperwork, any laboratory forms, and then these handouts. And it's wonderful because as I'm walking into the room, they're often reading those handouts already, and it's sparking conversation. It's bringing up questions that they have. And then again, if there isn't enough time to touch on everything fully, they can take those back with them, send questions through our portal if they need to. But it is, I think, become an important part of our workflow. And it's actually been very easy to incorporate that into the workflow in a way that really helps patients too and starts conversations.
No, I really like the idea of having them like almost like light reading while you're waiting to get into the room. I think that's kind of a good idea because then they could spur some questions to ask you right away. Have you found anybody that comes back to the next appointment with questions that they had from previous meetings with you?
Absolutely. Sometimes there's follow-up questions. Sometimes, they'll follow up with one of the nurses with a question. But for the most part, I think in this set of handouts, we've tried to answer the most pressing questions, the most frequently asked questions. So there shouldn't really be much of a need for follow-up questions because we've tried to think of everything. And as you know, there's so much we wanted to put in the handouts, and you guys found a way to let us get it all in as concise of a way as possible without losing a lot of important content.
Yeah, it was a challenge for sure, but we somehow fit it all in.
We did.
All right, so we have just one question left. So we wanted to make sure that to have some time at the end for some audience Q&A. So again, if you have any questions, feel free to type it into the Q&A box or into the chat at any time, and we will address those at the end. So Kofi, this final question is for you. What do you hope will be the impact of these resources?
Yeah, great question. So when I see and look at these resources and I look at sort of what's happening anecdotally and across the country, when you're kind of looking at the experiences of families and focusing on those early days, I find that there seems to be this sort of growing disparity that's occurring, where some families are getting access to this great information, this updated, this high quality information, and a lot of families may not be getting that. And it's sort of creating this divide where these children are sort of starting behind the 8 ball. So the question is, like, how can we actually do that better? I do a lot of work in food and nutrition security. And when I see families that are experiencing food and nutrition security in particular, I know that there's some challenges around these ideas of 8 to 15 times of trying a food. Maybe this idea of trying food multiple times means that there may be waste that occurs. And if waste is occurring, families who are experiencing toxic stresses such as food and nutrition security, that brings up the anxiety even more, right? So the idea of giving this food multiple times, 1 or 2 is enough. If this child doesn't like it, let's go to what they like. It creates these food jags where the child is eating over and over the same thing. Families end up pressuring the children to eat more of the same thing so the child gets enough food, right? There's all this sort of fear and anxiety around feeding. Feeding is a developmental process, as Namali brings home over and over again. Feeding is also something that we need to understand and meet our families where they are. I feel like these guys are really critical because they do a good job in trying to create one of the tools that help to create a more even playing field by giving access to high quality information to all of our families. There are so many other issues out there that are needing to be addressed as well. I'm not saying this addresses everything, but at the same time, it starts to move us with more and more tools towards that place where families are getting good access to high quality information in busy practices where you have 1,000 other things to go on, where you're the social worker and community health worker and doing everything else. These are great tools that can really help move us forward in that right direction where, again, all families can access, not just those with great needs.
I love that. It's leveling the playing field. So thank you both, Namali and Kofi, for being here today and being part of this honestly inspiring conversation. It's been an honor working with you all as we give families this opportunity to build that healthy foundation for their children. And I look forward to our continued collaboration. So, all right, the chat is now open, or the Q&A session is now open. So if you haven't already and you'd like to submit a question for Kofi and Namali, go ahead and type your question and we'll get to you as many as we can in the last 15-20 minutes that we have left. So I have, I hear that the chat is disabled. So there is that Q&A box that you can type your questions into. So I have a few questions that are coming in here. So first is a question comment combo. This is an amazing project. Thank you. Are there recipes that go along with a series of handouts? Also, will these flyers be available in other languages? I'm at an FQHC in DC that has multiple language speakers, Bengali, Arabic, etc. So I don't know, Namali, Kofi, who wants to take that question?
Namali, you can start with that.
So we will be unveiling the complete set of handouts with a complete translation into Spanish, and welcome any suggestions for other languages, of course, resources permitting. We may have to look for some grants to do some of that work, but possibilities are endless, I guess. We recognize that Spanish is frequently requested translation in our experience, so we started there.
And then Namali, there's that question about recipes as well.
Yes, so the Dr. Yum project has endless amounts of recipes. The QR code that is featured at the bottom of each of the handouts actually goes to the Dr. Yum project's baby food toolkit. This is a place that families can really explore, where the handouts will be housed for sure, and also where there's videos and recipes. The recipes that we put in that particular toolbox we call baby food option recipes. So these are those family recipes like the curried lentils that have a baby food adaptation. So the methods include a small passage that explains how the recipe can be modified to make it safe for different stages of feeding. So that was an important thing for us to sort of lead families into a place where there's an endless amount of other ideas and recipes for sure. And that, that URL is dryum.org.
Great. And then there's a question here about how do we access the resources and will the recording also be available? So I can answer this. So yes, we will be sending everyone on the call today with a link after the call where you can download the free resources that you guys presented today. And then the recording will also be shared of today's presentation. And then another question came in here. So like, what's next for the handout? So I can kick it off and answer first. So we are interested, and when I say we, like PHA is interested in recruiting a couple sites with geographic diversity over the course of the next year to evaluate the use of these resources with clinicians and patients. So if that's interest of anybody on the call, we definitely want to chat some more. So I don't know, Namali, Kofi, if you have any other comments about what's next for the handouts.
So,
Yeah, I think, yeah, go ahead, Namali.
please, Kofi, you go.
I was just going to say, just continuing to study their effectiveness, trying to making sure that they are continuing to be adapted for what works for you. These are a first set that have been really, tested in many different venues, but now it gets out there into the real world. We want to hear from you. We want to know what's working, what's not working, and really sort of step that up. We're going to be doing some great research to really study their effectiveness, working with some big institutions on doing that. That's the goal, one of the goals moving forward as well.
I think also we're open to the idea of working with companies that may help us disseminate them through, for instance, EMRs or website content that might be available for pediatricians on their website. So preliminary discussions for those possibilities are happening as well.
Great. So this question's for both speakers. Do you work closely with a registered dietitian when addressing or working with feeding difficulties and concerns?
Kofi, you want to go?
No, yeah, I can start with that. So I think it's a great question, and I think there is a combination of people that we work with at our institution. So I'm at Children's National Hospital, part of a large health system. So not only do we have registered dietitians that we're able to work with greatly, but also our speech language pathologists. We're able to work with our physical therapists. We're able to work with occupational therapists. You know, feeding as a developmental process requires a large team at times. And it's not just ourselves, definitely not just the registered dietitians. This is a complex thing at times. And being able to know when to pull that trigger and tap into the right person is a great thing as well. So we do get a chance to work with registered dietitians at our site, which everybody doesn't, but we do.
Yeah, I would echo the same. Often when we have complicated patients with complicated medical issues, they land at Children's National because we're pretty closely located to Children's National, VCU, UVA, and those folks generally have a team which includes a dietitian, and I make a lot of referrals for feeding difficulties to speech language pathology as well, and feeding specialists. It really depends on the nutritional status of the child and the overall medical picture, but really couldn't manage those kids without those important healthcare professionals.
Yeah. Another question that came in, or comment as well. Thank you for this incredible resource. The handouts appear to include a lot of good content. What literacy level are the handouts? What is the language level for these materials?
I don't know that we came up with an actual exact level. I would say that we did try to make sure that the handouts were very clear and conversational. Carmen, do you have a sense of where we might land?
I think you're exactly right in the sense that we didn't assess a specific reading level, but with that sensitivity review that we had completed, the idea was to make it easy to understand. So removing idioms or things that might be more clinical focused and making it more conversational was key, but we are interested in their feedback. So we are soliciting feedback at the end of this call from all of you watching. So if you're reading through the handouts and you have anything to flag, we're definitely interested in your feedback with our survey that we'll be setting out.
In addition to our focus groups as well, right? So we were able to test it with some families as well that seemed to work really well for them as well. But again, these guides can be dynamic, but right now they're ready to go. They're ready to be implemented, but we do want to hear back from you all.
Exactly. The focus groups are key as well. So next question is, apart from pediatricians, how else do you hope these handouts are disseminated?
I will be interested to see all the ways that the handouts take flight and are disseminated. I know that handouts that we started with were made part of the WIC experience in our local health departments. So those handouts were disseminated at visits at the WIC offices and were met with a lot of good feedback. So that's one way. I could see a lot of ways. I've talked about these handouts with early Head Start providers who are family engagement specialists who are going into the homes of kids in early Head Start and can see a real need or application for those handouts within staff like that who are interacting with families in the homes. Kofi, do you have other ideas? I'm just trying to think outside here.
Yeah, I think it's a great point. So, you know, when you think about these young children, you know, one of the things that we get a chance to do is work with a variety of community-based organizations. So our institution, we have some really nice clinical community partnerships that we have with other community partners, whether the dietitians on staff, chef instructors on staff, but you have kids of different ages. And a lot of the parents will come in or have hit a reset button. They want to sort of make a change within their family, and they're trying to figure out some good strategies. These are good tools to be used at some of our community-based organization partners as well, to be able to provide to families with young children. We think that that's a great tool that they can use. It can also be used as a tool for researchers as well, as they are providing good handouts and materials for their people on their research teams. So I think that's a really good thing as well.
And I also want to highlight that part of our Veggies Early and Often campaign is that we have a coalition, which you both are part of. And on that coalition, we are brainstorming ideas on how to disseminate these resources in kind of unique ways, which is kind of what you guys are both talking about. So there is some thought being put behind it. And we always welcome more ideas as well. So one next question is, somebody mentioned that the colors are beautiful, and I agree, it's very eye-catching, but can you print in black and white?
You can. And our graphic designer was very, Emily Hansen, she's fantastic to work with, and she was very keenly aware of the fact that most of us may not have access to color copying. And so she made sure that the colors really worked well with black and white printing. And
Yeah,
I imagine that most of the handouts will be disseminated in black and white.
And I will say, I'm still that person. I know I'm like younger, but I'm still that person. I like printed materials and I'm like reading. So I actually printed them all in black and white to do like a final read through. And we had a few edits that changed after we realized that some of the colors didn't bleed together. So they do look nice in black and white. I will admit that. The next question here is, can you explain a little bit more about the process that was taken to create these handouts? So I know we had mentioned like the sensitivity review and the focus groups, but like before that, what was the process?
Well, it was a lot of hours on Zoom. I think, we used some of the material from the earlier iterations of the Dr. Yum handouts as a starting point. And I think it was a really very collaborative process between all of our team members. And it was very careful and very measured. I mean, every line that's in this set of handouts, we really considered what we were saying and if we were giving the right message and if we were delivering that in a sensitive way. So we worked carefully one handout at a time chronologically, and we made sure that our team was happy with it. And then we passed it along to the PHA team to add their details, and then to the Lexington writing group for the sensitivity review. And I will say that there was a lot of learning in reviewing their edits. And I feel like I learned a lot from the writing that they put into the project, which I think has informed the way even that I talk to patients. So it was a very, very collaborative process. And then there were many, many edits just to make sure that we could fit everything into the space that we had allowed ourselves. And we definitely could have run on longer, but we knew that we had to stick to a minimum number of pages, because we know that you all don't want to be handing out a book at every visit. So that made it challenging as well. And thank you to our graphic designer for really sticking with us through a lengthy process of editing and making sure that everything looked right, that every picture was reflecting what we were trying to communicate in the handouts. Really till the bitter end, we were working on this thing with everything we had.
Can I highlight one more thing? This was the first chance I have gotten a chance to sit one-on-one for hours at a time with a speech therapist and work with them, right? So like, yeah, we do the phone calls, we do the sort of referrals and the consults, but getting a chance to understand how they approach feeding as a developmental process, getting a chance to sit with them and understand the whole sitting up, the feeding process, how the tongue is moving. It was a powerful, powerful master class to be able to sit with Melanie Poltok in particular. Was one of the great ones that I got a chance to sit with through this process. But again, understanding the expertise from our end and then bringing that in, it just really enhanced everything. So it was, again, a great thing to be able to bring together a multidisciplinary class of groups together and really grow with each other, sharpen each other, and make sure that we create the best tools that we could find and create using the most updated evidence to provide for our providers around the country.
I love it. I also learned a lot and very much enjoyed it as well. So a question here. Somebody works as a nutrition educator at one of Children's National's primary care clinics. Will both hard copies and electronic versions in different languages be shared throughout the hospital?
So I think that, we hope so. Please feel free to do that. I don't have complete control of any of that, but every department will make their decision. Hopefully they get exposed to this. I will let them know about this great resource. At the end of the day, it has to be adopted. And we know there's a lot of things out there that you can take on, that you can use to talk about a variety of different topics. We hope that this is a one-stop shop, that you can find all of these great resources, understand this, kind of think of it like the CDC guides, how they have them broken down by developmental stage. This is the kind of thing that it kind of replicates, really focusing on feeding as a developmental process. So yes, we hope that hard copies and electronic copies will be available everywhere. Do you have the space for them? Which is important. And also, are you all willing to adopt them into your practice, into your everyday practice? We hope so.
And we just have a comment here that somebody just sent in. I totally agree, Dr. Essel. Nutrition's not only what you eat, but what your child's ability to chew, swallow, oral motor skills, sensory processing issues can all stand in the way. I've learned so much from occupational therapists also. So you're not the only one that continues to learn. All right, so last question, and I love this one, and it's for both of you. In one word, how do you want families to feel after reading these handouts?
Ooh. Inspired.
Satisfied.
Satisfied, is that what you said? So I would say inspired. Just we know there are so many barriers to eating well. There's so many barriers to raising children to eat well. And it's hard, it really is. But if we can just get families to make one small step, that often creates motivation and cascade of bigger change. And so I hope families feel inspired to put their best foot forward and take that small step to raising a better eater.
Satisfied is my one word.
All right, well, I want to close by again thanking both of you, Dr. Namali Fernando, Dr. Kofi Essel, for your insights and support of PHA's Veggies Early and Often campaign. I also want to thank each of you for making time to attend today's webinar and listen to the conversation. We hope you're excited to take a closer look at the new resources and consider ways to adopt them in your clinic or integrate them into your parent education. So before we close, I want to reinforce PHA's call to action for clinicians and champions of first foods. You play a critical role in helping families to build that strong foundation for healthy eating habits during those first 1,000 days of life. So we encourage pediatric clinicians, residents, other medical professionals of kids ages 0 to 2 to use our anticipatory guidance to help families raise adventurous eaters. To support you, PHA will send you a link after today's call where you can download all the free versions of the resources that Kofi and Namali presented today. We'll also share that recording of today's conversation, and we encourage you to complete a short survey after you've taken a look at the handouts. We welcome your feedback and insight. That's our call for today. To learn more about PHA's Veggies Early and Often campaign, please visit our website at ahealthieramerica.org/firstfoods. Thanks, and we'll see you next time. Have a great day.